Hemorrhoids are veins that become inflamed in the rectum and anus, causing significant discomfort and potentially bleeding. Many people are embarrassed to talk about them, but what most people don't know is that they are more common than one might think. Watch this video to learn what hemorrhoids are, how to prevent them, and some tips for treating hemorrhoids. What are hemorrhoids? They are dilated veins that appear as small purple or reddish bumps, or sometimes red and inflamed, around the anus, rectum. There are two types, internal, which appear in the inner lining of the rectum, and external, which are outside the rectum and can be felt when touched. What are the symptoms of hemorrhoids? According to recent studies, nearly 40% of people have hemorrhoids, but most don't pay attention or don't know because only 45% of this group have symptoms. Symptoms depend on the type of hemorrhoid. Internal hemorrhoids usually cause pain and bleeding, which you will notice when you use toilet paper. It is important to contact a doctor, as other conditions can also cause rectal bleeding. In the case of external hemorrhoids, some types cause pain and do not bleed, especially when they are thrombosed hemorrhoids. These have blood clots that cause a lot of pain. You can feel them by touching the outside of the rectum. Typically, the inflammation and clot decrease on their own over time. Some people prefer to have surgery to resolve them. How to diagnose hemorrhoids? A doctor can quickly diagnose hemorrhoids with a simple examination. External hemorrhoids can be diagnosed just by looking, without the need for instruments. For internal hemorrhoids, it may be necessary to insert an endoscope into the anus using a tube. This examination is called an anoscopy. They can also be diagnosed with a colonoscopy. How to treat hemorrhoids? If hemorrhoids don't bother you, then you don't need to do anything as they will disappear over time. If they do bother you and hurt when you go to the bathroom, you can follow the tips below to try to reduce the pain. Prevent constipation. The most common cause of hemorrhoids is constipation, difficulty evacuating, and other types of bowel issues that cause hemorrhoids to become inflamed. If you suffer from constipation, eat plums, they are great natural laxatives. Avoid sitting on the toilet for long periods. Fluids. Stools need plenty of fluid to pass more easily. Fibers. Fibers help with bowel movements. An adult needs 5 servings of fruits and vegetables per day. Epsom salt. It can be used to relieve the pain caused by hemorrhoids. Simply take sitz baths with Epsom salt several times a day. You can use a bathtub or a shallow basin/bucket with a wide opening that you can sit in. Mix the salt well to dissolve it before sitting. Hemorrhoid creams. Products like Proctil, Ultraproct, Proctacin, and others containing hydrocortisone are used to relieve pain and can be applied directly to external hemorrhoids or with an applicator for internal ones. Surgeries. These are performed in more severe cases and as a last resort. The most common procedure is rubber band ligation of hemorrhoids. There are other procedures like laser removal or injecting chemical agents. It's important to remember that pregnancy is also a factor causing hemorrhoids. All pregnant women will eventually develop hemorrhoids. However, they are usually mild hemorrhoids that go away over time without needing other procedures. In severe cases, it is very important to contact a specialist doctor. If the tips do not help relieve the pain, also consult your doctor so they can prescribe a stronger medication.